That itch on your skin you keep brushing off, the one that comes back in the same spot without a rash, without a bug bite, without any explanation you can see, your body is trying to tell you something. Not every itch is dangerous, but there are 5 specific locations on the body where persistent, unexplained itching is not a skin problem. It is your internal organs signaling that something is wrong. And in several of those cases, the research links it directly to cancer developing silently, long before any scan would catch it. You need to know which 5. I'm Dr. Elena Marsh. I've spent over 2 decades in clinical medicine, and I want to tell you something that took me years of watching patients to fully understand. The body rarely goes silent before something serious happens. It speaks. Most people just don't know the language. Itching, pruritus in clinical terms, is one of the most underestimated signals in internal medicine. A 2019 review, published in the Journal of the American Academy of Dermatology, identified systemic pruritus, itching with no visible skin cause, as a documented early marker in multiple internal malignancies, including lymphoma, bile duct cancers, and certain leukemias. The problem is not that the signal isn't there. The problem is that most people wait months, sometimes years, before mentioning it to a doctor. By then, the window has often narrowed. Quick question before we go further. Have you or someone you love experienced persistent itching in a specific area of the body with no obvious skin cause? Write yes or no in the comments right now. I read every single one. Let me explain exactly what is happening inside your body when this kind of itching occurs, because understanding the mechanism is what will help you recognize it. Your skin and your internal organs share a communication system. It runs through your nervous system, your blood, and a network of immune cells that travel constantly between your gut, your liver, your lymph nodes, and the surface of your body. When something goes wrong internally, when a tumor begins forming, when a bile duct becomes obstructed, when lymph nodes begin to swell with abnormal cells, that communication system sends signals outward. And one of the ways those signals manifest is as itching. Persistent, localized, unexplained by anything you can see on the surface. This is not an allergic reaction. This is not dry skin. The technical mechanism involves bile salts accumulating in the bloodstream when the liver or bile ducts are under stress, and those salts deposit into skin tissue, where they activate nerve fibers called C fibers. Those fibers were designed to detect damage and report it. When bile salts reach them, they fire. And your brain registers that firing as an itch. In the case of lymphoma, cancer of the lymphatic system, the mechanism is different but equally direct. Malignant lymph cells release cytokines, chemical messengers that circulate in the blood and trigger inflammatory responses throughout the body. One of those responses, documented in the British Journal of Hematology, is generalized or localized pruritus, itching that can precede the diagnosis of Hodgkin's lymphoma by up to 5 years. 5 years. That is not a footnote. That is a window. Now, most itching is not cancer. I want to be completely clear about that. Dry skin, eczema, contact dermatitis, medication side effects, these are common, benign, and easily explained. What I'm talking about today is something specific. Itching that is persistent, that comes back to the same location, that has no visible skin change associated with it, and that does not respond to moisturizers or topical treatments. That combination, persistence, location specificity, invisibility on the surface, is the clinical red flag. And the 5 locations I'm about to walk you through are not random. Each one maps to a specific internal system. Each one has documented research connecting it to a particular type of malignancy. Some of these locations will surprise you. One of them, the third, is the one most people dismiss entirely because it feels like something far more ordinary. Stay with me, because recognizing these 5 locations is the first half of what I need to give you today. The second half, what to do the moment you recognize one, is coming, and it is specific. The first location is the lower legs and shins. Persistent itching on the lower legs, without a rash, without dry patches, without any change in the skin you can see, is one of the earliest documented signs of polycythemia vera, a slow-moving blood cancer in which the bone marrow produces too many red blood cells. What makes this particular itch distinctive is when it happens. It intensifies after contact with water, a shower, a bath, even rain on your skin. This is called aquagenic pruritus, and it is not a coincidence. The excess red blood cells in polycythemia vera release histamine when they come into contact with changes in temperature or moisture, and that histamine floods the nerve endings in your lower legs. The itch can be severe enough to disrupt sleep. Most people treat it with moisturizer for months before anyone thinks to run a complete blood count. The second location is the upper back, between the shoulder blades. This is where Hodgkin's lymphoma most commonly announces itself through the skin. The lymph nodes clustered in the chest and upper torso, the mediastinal nodes, are frequently the first to be affected. As those nodes enlarge, they trigger a systemic cytokine response that the nervous system reads as itch, and it surfaces most intensely in the skin of the upper back. What makes this location clinically significant is its persistence and its resistance to treatment. Nothing topical touches it. No antihistamine resolves it. It simply returns in the same location without explanation. A 2017 study in Lancet Oncology identified unexplained pruritus of the upper trunk as a presenting symptom in nearly 30% of Hodgkin's lymphoma cases, and noted that in most of those cases, the itch had been present for more than 6 months before diagnosis. 6 months. That is not a footnote. That is a missed window. The third location is one most people never mention to their doctor, the anus and perianal area. Persistent itching in this location is almost always attributed to hemorrhoids, poor hygiene, or dietary irritation. And most of the time, that attribution is correct. But when the itching is internal, when it does not respond to any topical treatment, when it intensifies at night, and when it comes with no visible external cause, it can be an early sign of rectal cancer or anal canal malignancy. The internal tumor creates pressure and localized nerve activation that the body cannot distinguish from surface irritation. Patients dismiss it. Doctors, given 10 minutes, rarely explore it. But in the research on colorectal cancers, perianal pruritus appears consistently as an early symptom, one that preceded diagnosis by an average of 14 months in a cohort study published in Colorectal Disease in 2020. 14 months earlier. Think about what changes with 14 months. The fourth location is the lower arms and hands, specifically the palms. Itching in the palms, not the back of the hands, the palms, with no visible skin change is a documented early marker of liver dysfunction and biliary obstruction. Primary biliary cholangitis, a condition in which the bile ducts inside the liver are progressively destroyed, produces palm pruritus as one of its earliest and most consistent symptoms. Left untreated, primary biliary cholangitis carries a significant risk of progression to hepatocellular carcinoma, liver cancer. The bile salts that back up into the bloodstream when the ducts are obstructed are fat-soluble. They accumulate most densely in the richly innervated skin of the palms, where they activate those same C-fiber nerve endings I described earlier. The itch is often worse at night and does not respond to any moisturizer or antihistamine. The fifth location is the scalp. Persistent, localized, without dandruff, without psoriasis, without any visible change in the skin. Unexplained scalp pruritus in adults over 50 is associated with cutaneous T-cell lymphoma, a form of cancer that originates in the white blood cells and initially presents exclusively in the skin. In its earliest stage, called mycosis fungoides, it can look like nothing more than a persistent itch in a single region of the scalp. No rash, no lesion, no visible abnormality. It is one of the most frequently misdiagnosed cancers in the country, in part because the first symptom feels so ordinary. You've been living with this language your whole life. No one ever taught you how to read it. That changes today. Now here is what connects all 5 of these locations. The itch itself is not the disease. It is the message. Your internal systems, your liver, your lymphatic network, your bone marrow, your bile ducts, do not have a direct line to your conscious awareness. They communicate through the nervous system, through the blood, through the skin. When something goes wrong deep inside, the signal travels outward. And if you know where to look, you can hear it before the damage becomes irreversible. Has your doctor ever explained this connection to you? Write never or yes in the comments right now. Your answer matters more than you think. This is where it gets specific, because knowing the 5 locations is not enough. What you do in the 48 hours after you recognize one of these signals and how you communicate it to your physician determines whether this information saves you or simply informs you. That is what the protocol is built for, and it starts in the next section. Stay with me. Here's exactly what I want you to do, starting today. This is called the Body Signal Response Protocol. 5 steps, no equipment, no cost. What it gives you is not a diagnosis. Only your doctor can do that. What it gives you is something more valuable in this moment, a clear, organized, medically communicable record of what your body has been telling you. and a precise sequence of actions that moves you from passive awareness to active protection. Most people who experience one of these signals do nothing for months because they don't know what doing something actually looks like. This protocol removes that uncertainty entirely. Step 1. Document the signal with clinical precision, starting tonight. The single biggest reason unexplained itching gets dismissed in a medical appointment is that the patient cannot describe it with enough specificity for the physician to act on it. "I've had this itch for a while" is not clinically useful. What is clinically useful is this: location, duration, pattern, triggers, and resistance to treatment. Tonight, open a notes application on your phone or take a piece of paper and write down the following 5 things. Exactly where on your body the itch occurs. Not my back, but between my shoulder blades, slightly left of center. How long it has been present, weeks, months, your best estimate. Whether it follows any pattern, worse at night, worse after bathing, worse at a particular time of day, whether anything makes it better or worse, water, heat, antihistamines, moisturizer, and whether you have tried any topical treatment and whether it had any effect. This document is not for you, it is for your physician. A precise symptom record changes the entire trajectory of a medical appointment. It signals to your doctor that this is not a casual mention. It is a reportable symptom that requires investigation. The biological reason this matters: physicians operate on pattern recognition. The more specific your description, the faster they can map it to a differential diagnosis. Aquagenic pruritus after bathing maps immediately to polycythemia vera. Nocturnal palm itching maps to biliary obstruction. Upper back itching, resistant to antihistamines maps to lymphoma screening. Specificity is not just helpful. It is the mechanism by which your symptom becomes actionable. Document tonight. Update it every day until your appointment. Step 2. Request the right blood panel, by name. When you see your physician, do not say, "I've been itchy." Say, "I have persistent, unexplained pruritus in a specific location that has not responded to topical treatment, and I would like to discuss whether a systemic workup is appropriate." Then ask specifically for a complete blood count with differential, a comprehensive metabolic panel, and liver function tests. These 3 panels together can identify polycythemia vera, biliary obstruction, early liver dysfunction, and certain markers associated with lymphoproliferative disease. They are standard. They are covered by virtually every insurance plan. And they are the first clinical step in ruling out or identifying an internal cause for your symptom. The biological reason this matters: systemic pruritus without a visible skin cause is, by definition, a signal from inside the body. A skin examination alone cannot find its source. The blood is where the evidence lives. Elevated red blood cell counts, abnormal liver enzymes, elevated bilirubin, atypical lymphocytes. The panel does not diagnose cancer. It tells your physician whether the next step is reassurance or further investigation. That distinction is everything. Request this panel by name at your next appointment. Write it down before you go. Step 3. Track the itch against your bathing routine for 7 days. This step is specific to the aquagenic pruritus pattern associated with polycythemia vera, but it applies more broadly as a diagnostic tool. For 7 consecutive days, note whether the itching intensifies within 30 minutes of contact with water, shower, bath, swimming, or even washing your hands with warm water. If you observe a consistent intensification pattern across 3 or more of those 7 days, include that observation explicitly in your symptom record and report it to your physician using the phrase aquagenic pruritus. That phrase alone changes what your doctor orders next. The biological reason this matters: the water-triggered itch of polycythemia vera is caused by mast cell degranulation in response to temperature change, a mechanism that is specific enough to be diagnostically significant. General practitioners may not connect an itching complaint to a blood disorder without that specific trigger pattern being reported. Your 7-day observation provides the clinical thread they need to pull. 7 days, 1 note per day. It costs nothing. Step 4. Rule out the benign causes first, systematically, not casually. Before your appointment, spend 1 week eliminating the most common non-systemic causes of persistent localized itching. Switch to a fragrance-free, dye-free detergent. Stop using any scented soaps or body washes on the affected area. Increase your daily water intake to at least 6 glasses. Apply a fragrance-free, clinically formulated moisturizer such as CeraVe or Eucerin, to the area twice daily. If the itch resolves completely within 7 days, the cause was almost certainly environmental or dermatological, not systemic. If it does not resolve, if it continues in the same location with the same intensity, that persistence is itself a clinical data point. Document it. Report it. The biological reason this matters: ruling out contact dermatitis, xerosis, and detergent sensitivity before your appointment means you arrive with a symptom that has already survived basic elimination. That changes the physician's interpretation from probable skin irritation to unexplained systemic pruritus requiring investigation. The difference in how aggressively they pursue a workup is significant. 1 week, systematic elimination. Document the result either way. Step 5. Know the combination that requires same-week medical attention, not next month's appointment. Unexplained itching alone is a reason to schedule a physician visit. But there is a specific combination of symptoms that requires you to call your doctor's office within 48 hours and use the word urgent. That combination is this: persistent, localized itching in any of the 5 areas I described, accompanied by any one of the following: unexplained fatigue that has lasted more than 2 weeks, unintentional weight loss of more than 5 pounds in the past 2 months, night sweats that soak through your clothing, swollen lymph nodes in your neck, armpit, or groin, or a yellowing of the skin or whites of the eyes. Any single one of those symptoms alongside the itch moves this from a scheduled visit to an urgent conversation. These are the constellation findings that hematologists and oncologists use to triage. You should use them too. The biological reason this matters: each of those accompanying symptoms represents a different systemic signal. Fatigue and night sweats are classic B symptoms of lymphoma. Weight loss is a metabolic marker of malignant cell activity. Jaundice is a direct sign of biliary obstruction or liver involvement. When they appear together with unexplained pruritus, the probability of a systemic cause rises sharply. Time is not neutral in these situations. Earlier investigation produces earlier answers, and earlier answers produce better outcomes. If you have that combination right now, this is not a video to finish and think about. This is a video to pause and make the call. You came into this video thinking an itch was just an itch. You're leaving with the science that explains why 5 specific locations on your body carry a different meaning, and a 5-step protocol you can begin tonight that costs nothing and requires no prescription, no equipment, and no waiting. That is not a small thing. That is exactly the conversation your last appointment didn't have time for. The body signal. Response protocol is not a diagnosis. It is a bridge between what your body has been trying to say and the moment a physician finally hears it clearly enough to act. Document the signal. Request the right panel by name. Track the water pattern for 7 days. Eliminate the benign causes systematically. And know the combination that makes this urgent, because if that combination is present, the time to act is not after the next available appointment. It is now. There is someone in your life who has been dismissing an itch for months. A spouse, a sibling, a friend who keeps mentioning it and then changing the subject. This video can reach them. Share it, not for this channel, but because the information their doctor never had time to give them is sitting right here, and it costs them 20 minutes to have it. If you haven't subscribed yet, please do that now. Every week, I bring research-based, honest information about what your body needs after 60. The kind of information I wish every patient had before they ended up in front of me. Everything I've shared today is based on published research and clinical experience. It is not a substitute for your personal medical care. Before making any changes to your routine, or if any of the symptoms I described today apply to you, please speak with your own doctor first. They know your history. Bring this information into that conversation. That is exactly where good medicine begins.